Manisan Hapade, Todos Hamzu. This hearing by the Committee on Public Accountability, Human Resources, and the Guam Build-Up is called to order. It's about 5:06 p.m. And for the record, and in accordance with 5 GCA Chapter 8, subsection 8107, public hearing notices were sent on Wednesday, November 11th, 2020, adhering to the 5-day notice, and a second public notice was sent on Tuesday, November 17th, 2020, 48 hours prior. In addition, this hearing was noticed on the legislature's website, www.guamlegislature.com. Written testimonies may be submitted by emailing speaker@guamlegislature.org, or you may hand deliver it to our office at 163 Chalan Santa Papa, Aganya, Guam. On the agenda, ladies and gentlemen, we have 5 bills, if I'm not mistaken. And we have bill number 302-35 COR, introduced by Senator Luis B. Muña, an act to add a new section 18903 to Article 9 of Chapter 18, Title 22, Guam Code Annotated, to amend the title of Article 9 of Chapter 18, Title 22, Guam Code Annotated, relative to prohibiting health insurance companies from canceling or reducing covered benefits for covered patients who enroll in qualified clinical trials. Second bill is bill number 304-35 COR, as introduced by Senator Luis B. Muña, an act to add a new Article 26 to Part 2, Chapter 12, Title 10, Guam Code Annotated, relative to authorizing access to and use of experimental treatment for patients with an advanced illness, to establish conditions for use of experimental treatment, to prohibit sanctions of healthcare providers solely for recommending or providing experimental treatment, to clarify duties of a health insurer with regard to experimental treatment authorized under this act, to prohibit certain actions by public officials, employees, and agents, and to restrict certain causes of action arising from the experimental treatment. This act is known as the Right to Try Act. The next bill is bill number 325-35 COR, as introduced by Senator Amanda Shelton, Vice Speaker Selena Cruz Nelson, and myself, Speaker Tina Rose Muña Barnes, is an act to add a new Chapter 29 to Division 2 of Title 22, Guam Code Annotated, relative to requiring insurance companies to cover telehealth and telemedicine services during public health emergencies. Next bill is bill number 316-35 COR, as introduced by Senator Teresa M. Terlahi, an act to amend Section 1909A of Title I, Chapter 19, and to amend Section 22203 of Title 5, Chapter 22, Guam Code Annotated, relative to increasing transparency and accountability by requiring early submissions of financial statements and financial audits. Bill number 418-35 COR is introduced by Senator Joe S. San Augustine, is an act to amend Section 8104P of Article 1, Chapter 8, Title 4, Guam Code Annotated, relative to including Department of Corrections parole officers as uniformed personnel for retirement purposes. Joining me here this evening, ladies and gentlemen, are my colleagues. I see Senator Teresa Terlahi. I see Senator Luis Muña. I see Minority Leader Senator Tello Taitigui. Thank you all for joining me, and I will share with all the present in this Zoom this evening. I know that more of my colleagues will come on. They've just asked me to go ahead and proceed in the interest of time, and they will chime in as soon as they can get to their computers. Also confirmed to join me this evening, and I'll go ahead and just mention as I see it on the Zoom, I have the Public Auditor, Speaker Benjamin Cruz. Thank you so much. Good evening. Thank you for being here. Director Ed Byrne from the Department of Administration. I see Mr. Michael P. Pinata. I guess you're representing Department of Corrections. And I see Dr. Suzanne Kaneshiro from the Department of Public Health and Social Services. Thank you. Good evening. Thank you for joining us. And of course, Mr. Frank Campillo from Select Care, thank you so much for joining me. I hope that's everyone. If I missed you, I apologize. But I'll go ahead and announce any chance I get. So with that being said, uh, we ask that those testifying abide to the following: to broadcast from a quiet room with little to no interruptions, to broadcast from a room with adequate lighting, specifically to ensure the participant's face is visible and not backlit, to ensure participants' face is visible at all times, to be properly attired, and to use only respectful and professional language and conduct. Virtual backgrounds should not be utilized during public hearings. I ask everyone here to keep your audio on mute until you are recognized, just to help prevent the reverb from happening. And also, please remain in the meeting room for any questions from my colleagues after all the presentations are done. And I must say, those who do not follow these rules of engagement will be removed from the meeting room. And those are the rules of engagement for this evening. And with that being said, we'll go ahead and move on to the first item on the agenda. I will also note for the record before I call Senator Luis Muña is I do know that some of you that are participating here tonight want to speak on one or several or all the measures. If you do and you want to, in the interest of time, if you want to talk about them, I'll go ahead and allow it with its similarities, and then hopefully you can stay for the questioning part. So Senator Luis Muña on bill number 302-35 COR, I will recognize you at this time.
Thank you, Madam Chair, and thank you everyone for being here today in this public hearing, most especially after hours. And I just want to acknowledge Frank Campillo. I'm sure he's going to miss me after December. So I just wanted to, I'll go ahead and I'll just read the title once again, Madam Chair, okay. This is bill number 302-35 COR, introduced by myself, Luis B. Muña, which is an act to add a new subsection 18903 to Article 9 of Chapter 18, Title 22, Guam Code Annotated, and to amend the title of Article 9 of Chapter 18, Title 22, Guam Code Annotated, relative to prohibiting health insurance companies from canceling or reducing covered benefits for covered patients who enroll in qualified clinical trials. The Patient Protection and Affordable Care Act, also known as Obamacare, prohibits insurance companies from canceling health insurance coverage if the patient participates in a clinical trial. This bill prevents insurance companies from canceling coverage for illnesses, and most especially cancer patients who qualified or who are qualified to participate in a clinical trial. It does not require the insurance company to cover clinical trials. The continual coverage requirement does not apply to every clinical trial. There are only 6 organizations that qualify for clinical trials under the ACA, the Affordable Care Act. So the same organizations are also covered by this bill. So really what this bill is doing is it's just allowing the patient to have continued coverage beyond or during their clinical trial. It is not forcing the insurance companies to pay for the clinical trial. And I welcome the discussion and any questions that any of the members or participants may have. Thank you, Madam Chair.
Senator Muña, those that are here confirmed to testify, I think President and CEO of NetCare, I think that's Lieutenant Governor Kurt S. Moylan, Frank Campillo from Cabo Select Care, Frank Ariola from Aetna, and Daphne Schimmel is the Director of Revenue and Taxation. And I did not see Mr. Byrne here if you wanted to testify. So if none of the agency directors, I'll go ahead and he is Mr. Kurt Moylan or Jerry Crisostomo here? If not, I will note for the record that there is a a testimony from Jerry Crisostomo, sent an email on this bill. And if time permits, I'll go ahead and read it. But I'd like to go ahead and go down to Mr. Frank Campillo from Select Care and address you at this time. Again, state your name for the record, where you're from, if you're in support or not in support of the bill.
Well, thank you, Senator. This is Frank Campillo from Cabo Select Care on Bill 302. Actually, you suggested that for the purpose of efficiencies that we could have testimonies on bills that are kind of the same, so if you don't mind, I'll be happy to kind of testify on 302, 304, and 325. Okay, so
Yes.
So for the purpose of brevity, and we will submit written testimony on these bills, but to my knowledge, we, as at least when we said we, Cabo Select Care, we comply with the requirements of non-cancellation of policies. I'm not aware of anyone in the industry locally that is taking such actions. So we comply, so that shouldn't be any problem, at least on our side. On Bill 304, the same, I think we comply with the requirements of providing the benefits that are still provided to members that are going through clinical trials, and those are the benefits that are clearly stated by the plan. So we will submit the additional testimony in writing. And in regards to bills 325, the telehealth and telemedicine, we are currently providing the telehealth services as required by CDC and the guidelines that were issued by Health and Human Services, requiring insurance companies to provide this service. One thing that, Senator Muña, we will miss you, because I'm sure that I will be running around and seeing you often. So, but one of the things that I wanted to bring to the attention of the senator is that earlier, when telemedicine and telehealth was being reviewed by various providers, actually providers from the Philippines were calling and trying to find out if they can actually do continuity of care for members or for their patients that were here. And I guess there are licensing issues that I think the Guam legislature should consider when looking into a bill like this, because if we're going to have through telehealth and through telemedicine, we need to realize that many patients from our jurisdiction in Guam also have providers that are outside of our country, and that there may be some licensing issues with them providing services that are deemed to be being provided in Guam. So I will provide further testimony to so you can see what the suggestions that we may have in regards to telehealth and telehealth and telemedicine. Okay. Also, if I may, at this time, since we're doing a public hearing, I'd like to give a suggestion to the Guam legislature. There is significant concern for the financial crisis that we're experimenting right now as a result of the pandemic, and a significant number of private employers and employees are actually losing health insurance coverage. This is a huge concern that we have. I think, Speaker, we have provided copies of letters that we have sent to both the CNMI and the Guam congressmen in regards to supporting actions taken by the United States Congress to extend benefits and services to employees that lose coverage, vis-a-vis supporting COBRA by providing some additional sources of income for individuals that lose health insurance and subsidize COBRA. This was done during the financial crisis in 2008 and 2009, and we're suggesting and are asking the Guam legislature to try to support these ideas and send communications to both the CNMI and the Guam congressmen to see if they can get the additional subsidies for COBRA included in the next set of pandemic recovery that are passed by the United States Congress. Thank you, and we will send to you written testimony on all of these bills. Thank you very much.
Ms. Mossy, Mr. Campillo. Is Mr. Frank Ariola here? Dr. Suzanne Canashero, did you want to say anything on behalf of public health? On Bill
No.
302?
No.
Thank you very much. At this time, if any of my colleagues have any questions for any of my colleagues, and I also want to recognize the presence of our Legislative Secretary, Senator Amanda Shelton. Thank you for joining us. At this time, do any of my colleagues have any questions for the panel who spoke earlier on Bill 302-35? If not, Senator, Senator Muña, I'll go ahead and yield to Senator Therese Terlahi. Please proceed.
Thank you. Yeah, so on Bill 302, I just have one question for Mr. Campillo. If so, the bill says that if the Affordable Care Act is no longer applicable to Guam, then we're mandating that this coverage continues. And you said that's not a problem because you're already covering that. But if the ACA is no longer applicable to Guam, how do we know that you would continue to cover that, or other insurance companies as well? I mean, is it mandated elsewhere, or do we need this law to mandate that?
Good question, Senator. Well, first of all, let's just start from the point, from the perspective that the entire ACA does not apply to the territories. So only parts of the ACA apply to the territories. And I believe this is one of those parts that apply. The non-cancellation and rescission of coverage. So for as long as the ACA continues, I think we're okay. And I don't think, I don't foresee any problems with the ACA not continuing, by the way, Senator. Yeah.
Okay, well, I thought that was the premise of the bill. So I hope you're right. But yeah, I thought the premise of the bill was if it doesn't continue, then we should mandate it by these statutes. And I just want, my other question is just, this coverage affects all insurance companies beyond, if in the language in this bill, it would affect all insurance companies, not just those that are providing coverage for government of Guam employees. Is that correct?
That seems to be correct.
All right, thank you. Thank you.
Thank you. Legislative Secretary.
And if I may, Senator, like I said, we will send our written testimony, which will expand on all of those items.
Thank you, Frank. Legislative Secretary, any comments or questions on this?
Thank you. No questions at this time. Thank you very much. And thank you for being here today, Mr. Campillo, for your testimony.
Thank you, Senator.
Minority Leader.
Thank you, Madam Chair. Did I see somebody from Public Health that was here?
Dr. Canashero's here from Public Health.
Okay, from Public Health. Okay. Well, I do have a question with regards. Okay, so the bill is for clinical trials, benefits for covered patients who enrolled in qualified clinic trials. Okay, the question I have for Public Health. What role, if any, does public health or social service play with respect to advanced preparation, identification, and participants reporting of successful, unsuccessful outcomes, public awareness or safety measures, etc.? Hi, Dr. Canashero. You want me to repeat that again? I don't know if you just got on, but
Well, Senator, we don't actually do clinical trials in public health.
okay.
We actually don't. We don't participate in that, actually.
Okay, so so with respect to advanced preparation, okay, so they don't, and social services. So to Frank Campillo, what information is known about individuals from Guam who participate in clinical trials, like number of men, women, children? Do you have any of these examples, or do we wait for your testimony? Sorry, Frank.
Oh, well, Senator, thank you. The numbers are very small, and I believe that one clinic here has begun doing clinical trials, and the numbers may increase through that. But the numbers going outside of the island for clinical trials is rather small, because some may require individuals relocating to that area to have continuation of the clinical trial. So the numbers are small. I guess the local clinic that is beginning to provide this service through clinical trials may increase those numbers. And by the way, Senator Terlahi, one correction. The ACA employer mandate really does not apply to Guam in regards to having to provide health insurance coverage. So that's a technical correction that needs to be made on the bill. The ACA employer mandate does not apply to Guam.
Okay, well then I'm sure you're going to put that in your testimony that you're going to provide to us, Frank, that information. I'd like to see the numbers too, and what clinics on Guam that provide this kind of trials.
I think public health may have better numbers than we have, because we may only have numbers that are in respect to those that we insure and that may be participating in clinical trials.
Okay.
In fact, the one that can provide you those numbers is Dr. Samir. He's very involved in these clinical trials, and I think Samir can provide those numbers. In fact, if the legislature wants those numbers, I can contact Dr. Samir to provide those numbers.
That would be helpful, Frank, as well. And maybe you might want to, when you're doing your paper and turning it in for us, your testimony, you might want to include that, as well as Dr. Kaneshiro. You just heard what Mr. Campillo said. If there's any way you can reach out to someone in public health with respect to that, to get some numbers for us, I greatly appreciate it.
Okay, I will look for you. I will look for that.
Thank you so much, Dr. Kaneshiro. Thank you, Madam Speaker.
Thank you. Senator Luis, any comments or questions to close on the bill?
Well, first of all, I want to thank Frank for, for helping us strengthen this, and for your ability to help patients beyond, prior to and beyond their cancer treatments. It really does go a long way, understanding that people who have these critical illnesses, and such as cancer, they have other things to worry about. The last thing they want to worry about is making sure that they have coverage, even beyond or throughout their clinical trial. That's the last thing they want to worry about. So really, this is one of the reasons why I've talked to maybe just a handful of people who had participated in this clinical trial, and not all of the outcomes are successful, but just knowing that we have the insurance companies to take care of us, beyond whatever treatments that they have to go through, clinical trial treatments that they have to go through. Just to close, Madam Chair, this bill doesn't require health insurance companies to cover experimental drugs or any part of the clinical trial. It really just prevents, companies like Frank Campillo's company from canceling the coverage of sick patients, especially cancer patients, and those with chronic diseases that participate in a federally approved or funded clinical trial, and a few other drugs that have an investigational drug application with FDA or are FDA exempt from the application process. And I thank companies such as Select Care, for continuing that coverage, not necessarily having to be mandated to do it, but I'm just glad that they are doing it. Thank you very much, Madam Chair.
Thank you very much, Senator Muña. For the record, I also want to note that we did extend invitations for this public hearing to the Guam Medical Association, to the Guam Medical Society, and of course, the Director of Public Health and Social Services, Dr. Kaneshiro, is here for Public Health, and to the Health Plan Administrator of Take Care, and then Select Care is being represented by Mr. Campillo. So those folks were also invited. I did get written testimony, like I said earlier, from Mr. Crisostomo, and I'll go ahead and read it into the record. Hafaday, Speaker Barnes, and members of the committee, thank you for the opportunity to submit written testimony via written testimony via email on bills 302, 304, and 325. While I appreciate the intent of these three legislative initiatives, which I assume is to provide better coverage and access to care, and while noble as it may be, we also need to balance the intent of these initiatives with the cost and affordability of healthcare overall. Unfortunately, these bills do nothing to reduce or control the cost of healthcare, but rather have unintended consequences of making healthcare unaffordable. We already have a fragile economic environment that is on life support with 30,000 unemployed with no health insurance coverage that will only exacerbate and overwhelm an already dire public health system on island. Our island's insured population is shrinking every day, primarily due to the pandemic, with business closures and or employees layoffs. These new mandates will only create additional financial burden to the insured population unnecessarily. While I'm not necessarily opposed to these proposed initiatives, I strongly recommend that further deliberations, discussions, and a review of the financial impact these proposed bills will have on the cost of healthcare, and more specifically on the affordability of healthcare by the very population these bills are intended to assist. Please know that any federal or local mandates will most certainly have a negative financial impact on healthcare premiums, and therefore would recommend that these proposed bills be held in abeyance until a thorough review and analysis be conducted on its impact. Respectfully submitted, Jerry Crisostomo, Plan Administrator, NetCare. That's read into the record. And I will also note that on this bill, we did not receive the fiscal note. Did not receive the fiscal note, but has sent a message asking for an update. Next on the session agenda, ladies and gentlemen, is bill number 304-35 COR. Senator Luis Muña, I give you the floor again.
Thank you very much, Madam Chair. This is bill number 304-35 COR, introduced by myself. Is an act to add a new Article 26 to Part 2, Chapter 12, Title 10, Guam Code Annotated, relative to authorizing access to and use of experimental treatments for patients with an advanced illness, to establish conditions for use of experimental treatment, to prohibit sanctions of healthcare providers solely for recommending or providing experimental treatment, to clarify duties of a health insurer with regard to experimental treatment authorized under this act, to prohibit certain actions by public officials, employees, and agents, and to restrict certain causes of action arising from experimental treatment. This act is known as the right to try. Bill number 304-35, if it becomes law, will join, excuse me, just want to make sure. It will join 41 states to enact a right to try law. On May 30, 2018, President Donald Trump signed Senate Bill 204 into law, which enacted the Federal Right to Try Act. This bill will preserve right to try in the event the federal law is repealed. Unlike the federal law, this bill followed the path of the states which adopted model legislation created by the Goldwater Institute. It's a charitable organization created by the late Arizona Senator Barry Goldwater. It was his intent to make drugs that were undergoing clinical trials available to those with cancer, Alzheimer's, and other terminal illnesses. This bill provides basic liability protection for doctors and drug companies whose medications or treatments have passed stage 1 clinical trials. Stage 1 is the FDA approval stage where the safety of the drug or treatment is evaluated. Like the federal law, this bill does not require that these experimental drugs be provided for free or that doctors provide their service for free. It simply allows a drug to be used prior to full FDA approval. Unlike the federal law, the immunities of this bill are extending to pharmaceutical companies, but not their suppliers and subcontractors. There are some concerns that the Right to Try Act might be repealed by the next Congress. And so hopefully, if I can get support for this, that we can have this protection here. Thank you, Madam Chair.
Senator Muña, again, on Bill 304 dash 35, I see Mr. Frank Capillo. Did you want to add to that or just wait for questions?
No, Senator, like I said, we will submit a written testimony, but since Senator Muña brought up discussions on pharmaceuticals, actually, a speaker I sent to you, and I'm very glad to share for this committee some work that has been done by the Guam Chamber of Commerce, in which we're looking at alternative industries for Guam, realizing that our visitors industries are going to be hampered for a significant number of years to come due to this pandemic, and that we hope that all of you are able to look at these plans that are being put in place. And one of them is actually creating a pharmaceutical industry in Guam. And perhaps, Senator Muña, that will be something that will be attractive to try to get companies that produce these types of life-saving drugs to possibly get them to come to Guam. Details, information of the report have been provided to the speaker. And the speaker, you're more than welcome to share those with the senators. And remember that we also have protocols because we're going through the government agencies who are becoming partners of these endeavors. So that's something that we urge the senators, because we really have to look at alternative industries for the island. Thank you. That's the only comment that I have now.
Thank you, Frank, for that statement. And yes, I want to thank you again for your efforts in working with our committee and our policy team in reference to the pharmaceuticals and making sure that every opportunity we have to give some reprieve to our residents, but more importantly, to help them out and assist them, I think will be good for our island. So we will continue that work moving forward, and hopefully we'll get something in sooner than later. So I will go ahead and open it to my colleagues. Legislative Secretary, any questions? I apologize. I'll go ahead and ask Senator Muña, any comments or questions?
I could wait for until closing if any of the our other colleagues have questions.
Legislative Secretary? If none, Senator Therese?
Thank you. Just wanted to ask, so again, if this federal law is repealed and the government of Guam is mandating you as an insurance company to, well, I guess what it's doing is saying there's no liability. I guess, okay, never mind on that one. But could I ask Mr. Byrne, I know you haven't testified on this bill, but do you see any impact from this bill or Bill 302 on the government of Guam insurance? For example, do you expect it might affect costs or anything like that?
Thank you for that question, Senator. I really hadn't prepared any particular view on these particular two bills because they're general bills and not affecting the government. Mr. Campello, I think I said a bit earlier that it only affects a very few people, at least on when he was speaking about 302. So it would certainly be my hope that compliance with these particular bills would not cause a big cost impact.
All right. All right. Thank you.
And as Senator Muña said, they're not obligating the insurance companies to cover the actual clinical trial, but to continue covering the services that otherwise would have been covered for the individual patient. Correct, Senator Muña?
May I add, Speaker? I received an email from Dr. Shea. I'll forward it to you. It just says, we have medications that are currently effective and they are not covered completely. So I don't oppose clinical trials, but I think it would be premature to jump on the bandwagon to approve EUA drugs that really does not benefit the entire majority of the population. It will trigger a negative effect from private insurers. So if I could ask Mr. Campillo, what if there are any negative effects that we haven't discussed yet?
Well, clinical trials are a little bit different than drugs that receive emergency authorization from the FDA. For instance, we have a handful of tests and a handful of drugs that have been given emergency authorization for the coronavirus through the FDA, and those Dr. Shea is correct. There is no real clear results on those. For instance, one of those Redemsivir, for instance, is one that the WHO uh, is coming opposite of the FDA in regards to whether or not it is a drug that has that delivers clear results for the patient. So in that regards, I think Dr. Shea is correct in that particular regard.
All right, thank you. Thank you, Madam Speaker.
Thank you, Senator Terlahi. Minority Leader?
Thank you, Madam Speaker. Yeah, thank you, Madam Speaker. I would just anticipate the testimony from Frank Campillo when it comes in. Thank you so much. I have no questions.
Legislative Secretary, I know you were on earlier. Not at this time? Okay. I'd also like to recognize the presence of Assistant Majority Leader, Senator Kelly Marsh-Taitano, Sidus Masi for joining us. And then Senator Joe Augustine Sidus Masi for joining us. Senator Marsh-Taitano, do you have any questions or comments on this bill at this time?
Sidus Masi, Madam Speaker, and I am just coming in late, so I apologize, and I need to get caught up with everybody a little bit, but I'm here to listen, and I'm very interested in what is being shared, so Sidus Masi.
Thank you. Thank you, Senator. Senator Joe San Augustine, any comments or questions regarding Bill 304? If not, I'll go ahead and give it back to the author to close.
Thank you, Madam Chair. And again, thank you to everyone here who's providing information and all of the colleagues here to learn a little bit more about this right to try. Again, it's just basically the bill provides basic liability protection for doctors and drug companies whose medications or treatments have passed stage 1 clinical trials. The coronavirus pandemic has made us all so acutely aware of the importance of new drugs to prevent and treat COVID-19. I just want to remind everyone that cancer and diabetes, stroke, and heart disease continue to claim more lives. This bill will offer hope to our terminal patients that are told that there is no more hope. Let's give them the opportunity for the right to try here on Guam. Thank you, Madam Chair.
Thank you, Senator Muña. With that being said, we'll go ahead and move to the next bill, Bill number 325-35 COR. I will recognize Senator Amanda Shelton, our Legislative Secretary on the bill. She just, please, Mona.
Thank you very much, Madam Speaker, and I'd like to thank you also for hearing this bill tonight, and for all those who have provided testimony or who are here to testify on the measure. We introduced Bill 325-35 at the onset of the pandemic. You, Madam Speaker, along with Vice Speaker Talina Nelson, to require insurance companies operating in Guam to cover telehealth and telemedicine services during public health emergencies. Bill 325-35 will provide the necessary means for Guam residents to be treated via telemedicine to promote further health and safety in response to COVID-19 and the need for social distancing, and in preparation for future health emergencies. Telehealth is technology-enabled health and care management and delivery systems that extend capacity and access. Telemedicine is the remote delivery of healthcare services and clinical information using telecommunications technology, such as the internet, as we are doing now via Zoom, or wireless satellite and telephone media. Through various insurance Though various insurance companies and hospitals in Guam are restructuring and developing their telehealth and telemedicine service plans to combat the spread of COVID-19, Bill 325 is a proactive approach that aims at guaranteeing insurance providers today and future insurance providers in Guam cover telehealth and telemedicine during public health emergencies. And I know that we have great partners in the health insurance industry who have, during this time of public health emergency, covered all telehealth and telemedicine visits for their customers. And so we are very grateful for that. And we see Bill 325 as a means of safeguarding this kind of coverage for future customers in any type of public health emergency that may arise. And I welcome the testimonies tonight and anything, comments and suggestions today that may strengthen this bill and coverage for our community. So, Sutuas Masi, Madam Speaker.
Thank you very much, Legislative Secretary. At this time, again, invitations were sent out to the different insurance companies, but I will open the floor right now. If Department of Administration or Department of Public Health, if you would like to comment on this bill, Mr. Byrne, would you like to comment on this bill or?
Thank you, Madam Speaker. Again, I wasn't really prepared to do so, but our present insurer does cover telemedicine and telehealth, and I certainly would encourage, as part of any qualification by an insurer for GovGuam policy, would encourage them to do so.
Thank you, Mr. Burke. Dr. Kaneshiro, would you like to comment?
Yes. Hi, my name is Suzanne Kaneshiro. I'm the Chief Public Health Officer, Department of Public Health and Social Services. Good evening, Senators. The Department of Public Health and Social Services is in support of Bill 32535. COVID-19 has impacted Guam's healthcare system in various ways. Originally, all hospitalized COVID-19 positive patients were admitted at Guam's only public hospital, Guam Memorial Hospital Authority, and all non-COVID-19 patients were at Guam's only private hospital, Guam Regional Medical City. Both hospitals are now managing COVID-19 and non-COVID-19 patients because of the large number of patients that have to be admitted. Most outpatient clinics have reorganized and limited their office hours in order to promote adherence to social distancing practices, as well as to limit potential patient and or provider exposure. The Department of Public Health and Social Services Community Health Centers are the only federally qualified health centers on Guam and served 11,592 patients in 2019. Among our patient population, 95.7% are uninsured, underinsured, on Medicaid, or on the medically indigent program, our local public insurance. Our clinics remained open to provide outpatient and primary care since the declaration of state of emergency due to the COVID-19 pandemic, as stated in Executive Order 2020-03 on March 14, 2020. The community health centers scheduled patients for telehealth visits via telephone calls in order to promote adherence to social distancing practices and to limit any potential patient and or provider exposure. Bill number 32535 will provide more opportunities for patients with insurance to access telehealth services, which increases the availability of providers to safely treat patients with and without COVID-19, and at the same time minimize the use of personal protective equipment, supplies such as isolation gowns, N95 respirator masks, face shields, and gloves. The community health centers serve many patients with chronic medical conditions, including hypertension, diabetes, chronic kidney disease, and asthma. And these patients need frequent visits in order to maintain a state of good health. Many of our patients also have limited health literacy and therefore benefit from additional telehealth check-ins via telephone to review their home self-monitoring and medication compliance. Therefore, Bill number 32535 is extremely vital in allowing patients with health insurance to access their healthcare providers, most especially in times when social distancing and wearing face masks are key recommended mitigation means to protect ourselves from the further spread of a virus. Currently, the community health centers are in the process of upgrading patient telehealth services, such as utilizing video conferencing via mobile app, which will increase access for patients for these regular check-ins via telehealth, rather than in-person or face-to-face clinic visits. Again, this will preserve our PPE and cleaning supplies for use with COVID-19 patients who present to our clinics for testing and evaluation. In addition, regular communication with our patients to ensure medication compliance and appropriate monitoring at home will help prevent these patients from requiring care in our island's emergency rooms and hospitals due to acute disease worsening conditions. This will in turn help to free up hospital level resources to care for more COVID-19 patients. Thank you.
Thank you, Dr. Kaneshiro. Colleagues and those on Zoom tonight, I'm going to go ahead and read something from Edna. It says, "Dear Madam Speaker, thank you for the invitation to participate in today's hearing. We are unable to participate in a live session. We are supportive of Guam's interest to improve access to care, coverage, members, health, and cost containment. And that currently has policies and procedures in place to address coverage for the services being discussed. And we would be more than happy to meet with you and the Department of Administration to review in more detail. It's an honor to serve the Guam community and look forward to the opportunity to meet soon. Sincerely, Hassan Karbani, International Account Director." I just want to read that into the record. So Legislative Secretary, I opened you for comments or questions, or would you like to close? I leave that option up to you.
Thank you very much, Madam Speaker. I'll hold my comments and my questions till the end. I'll allow for our colleagues to ask their questions now.
Is there anybody wishing to have any questions answered to any of my colleagues? Senator Terlahi, you are recognized.
Thank you. So I know that at the beginning of the pandemic, there were many concerns. That I had received so many calls about, whether the services could be provided remotely and whether the insurance companies were covering it. I even received calls from certain providers that were saying the insurance companies were not covering it and could I help them? But it ended up, this I think is in March, very early on, that when I called around, it ended up they all eventually covered, or immediately ended up covering I think what was needed at the time or up to now. I just want to clarify, because the bill talks about, now this bill goes way beyond the government of Guam insurance contract. It's talking about telehealth and telemedicine for every private company, every private insurer, and every provider, and for all the people of Guam. So but it's limited to during public health emergencies. So of course I wholeheartedly agree that this should be a service during public health emergencies. And I just want to clarify though, there was a prior law that allowed let me get it right. That physicians who were here outside of Guam to provide telemedicine, and does that existing law allow telehealth, or can you just tell us, did you have to do something special? This is to the insurance companies, Mr. Capillo. Did you have to do anything special to get this coverage during the pandemic? Or, I know that CMS was trying to get that, across the board during the pandemic, but that I had the impression that it was not a normal coverage and that it was done because of the pandemic. Could you just clarify or confirm that?
Yes, Senator, as Dr. Kaneshiro said, the pandemic caused individuals and to actually be afraid of going to clinics, and rightfully so. And the initial mandate that was provided by CMS and by HHS and CDC requires insurance companies to cover the telemedicine. I think the telehealth. The telemedicine that you were referring to was an act that was enacted in the past. And I think some providers, if I'm correct, Cedar Sinai at one point tried to connect with even public health and a couple of other providers in the island. I think the practicality of it was not necessarily or has not necessarily been the best time-wise. But in regards to the current practice of covering for telemedicine, we are covering for telemedicine. I'm glad that Dr. Kaneshiro mentioned the fact that this allows providers in Guam to save from PPEs and to have less expenses. And one of the reasons why we suggest that telehealth services be recognized that the expenses is lower, so consequently the bills should be lower too.
All right. So would you say that it's solely at the discretion of the insurance company whether that they were able to provide that without being authorized to do so by law to expand their coverage during the pandemic?
No, I think we follow the law, but I think a lot of the technical issues basically is with the providers not necessarily having the technical abilities to provide the kind of telehealth. And I mean, like some providers thought that sending a simple text would be a telehealth visit, and that clearly is not, So I think a lot of that had to be with the technical infrastructure that providers didn't have. But we comply with it. I mean, there are now telehealth and telemedicine companies that have beginning to emerge in continental United States, and I think there's some that are trying to apply it into the island. And we have an association, for instance, with United Healthcare, and through United Healthcare, we have associations and access through those type of companies that are providing telemedicine and telehealth.
So do you think they would be able to do that outside of the health emergency? You're saying that's they're allowed to do that outside the health emergency?
Well, I think what coronavirus had made is exactly what Senator Shelton said earlier, made us meet in the manner that you can be at home and still meet with your colleagues. And I think overall, the future of medicine will be one that will allow for telehealth. And in fact, if I was you, already the federal government is mandated that we cover during the pandemics or during the emergencies. I don't think there is necessarily a special need to mandate this coverage and allow the market, because the future of technology is going that way. It's almost impossible to say that even after the pandemic that we won't be meeting through Zoom or through any of the other type of technologically advances that we have to have meetings in the future. So I would suggest to allow market forces and technical advances to allow for the application of this.
All right, and then so one of the provisions of this bill requires that services are provided in consultation with a healthcare professional licensed in Guam, who has ultimate authority over the diagnosis and care of a patient. Would you recommend that provision be kept? I mean, do they need to consult with someone on Guam, or yeah, are we trying to allow them to do that without consulting with a professional on Guam?
That's one provision that we are providing testimony in our written testimony, but it's one that for practical purposes, you may have your primary care physician being the one that handles your care locally for the purposes of even dispensing prescriptions. As I said earlier, something that the bill does not take into consideration is that we have many of our local residents going to countries outside of the United States, outside of Guam, like Taiwan and the Philippines, that became very popular for local residents, and that technically those individuals are not able to do continuum of care for residents of Guam. So maybe something to consider as well.
All right. I think currently, well, the bill is requiring that the provider, well, I guess I'm not sure whether the provider, if maybe you could talk about in your written testimony about the provider being licensed on Guam versus not licensed on Guam. I did receive many calls from pharmacists. They think, I guess they want to be covered in law regarding telehealth, and but I thought it was a provision of the insurance companies. Kind of, if they're covering them, then, and this is that was a little bit different. And is there a distinction between this on island, that everything's taking place on island, versus a physician or provider that is off island? What do you call it, telehealth, if it's a doctor and a patient at home on Guam? Both are on Guam, licensed on Guam.
Yeah, that's something that, again, the medical community needs to kind of give you some advice on that. But one that I also have concerns on continuity of care, especially since, again, many of our island residents seek care on countries that are not within the United States.
Okay, all right. I look forward to your
Locations,
testimony. Thank you. Yeah, still have some questions, but yeah, Mr. Byrne, and I'm assuming this has the coverage of this during a pandemic would have no impact on a government of Guam health insurance costs.
Well, that would only happen, Senator, if it happened to cross over a financial year, because we negotiate, as you know, we negotiate these rates in advance. So whether a pandemic hit, if there were any effect, it would be a delayed effect.
I see. I get it. Thank you. Thank you, Madam Speaker.
Thank you, Senator Therese. If no one else wishes to ask any questions or comments, Senator, as Legislative Secretary, Minority Leader, did you have a question?
Yes, I did. Thank you. This is for Frank. Frank, if for an example, if I were to go and get my lab work done, and especially during the pandemic, a lot of people were staying home and making calls to their doctors and stuff. But if I were to do my lab work, go into DSL, do my lab work, and then a week later when the results come in, usually I go see my doctor and they'll read the results to me. Now, if I don't do that and we do it on the phone, and my doctor will explain what the lab works came in, you're a good girl, you're a bad girl, don't eat this, don't eat, things like that. Is that considered telemedicine from there? Because if the clinic would charge me because of that phone call, is that what we're talking about, telemedicine in that perspective?
Well, I would let if I could, the author of the bill kind of suggest what exactly they would like to see on the bill. The CMS mandates, I don't necessarily think that is just to give you live results, but actually, for instance, a lot of what we've seen for the televisits that we see today are mainly for mental visits.
I see.
I don't see.
Because
Go ahead, I'm sorry.
Okay. Yeah, I was just wondering if my doctor, because they called me instead of my coming in there, charged the insurance company for a doctor's visit, or was that, something like that? Because normally you go in, for your results. So have you seen clinics or doctors charge that phone call to the insurance companies? Bill the insurance companies?
Good question, Senator, and I think I need to do a little more homework as to whether we're being charged for that particular type of visit. Yeah.
Okay, I appreciate that, Frank. I know you're going to be putting a bunch of testimonies together, but that's even then, nothing's too small when it comes to health, really. A simple blood test, versus a diagnosis. Nothing is too small. So the question is, do clinics or doctors charge the insurance company for phone calls? Thank you so much.
Thank you, Senator Tadegui. Legislative Secretary on the closure.
Thank you very much, Madam Speaker, again for hearing the bill tonight and for your co-sponsorship, as well as Mr. Campillo, Dr. Kenishiro, Mr. Byrne for being here tonight and the testimony that you provided. Dr. Kenishiro, especially from the Department of Public Health and Social Services, I appreciate the support of the bill and recognize that this bill does put some additional responsibility on the department to be the authority of this telemedicine program for the island of Guam. And so I know that there are still many things to work out and discuss further, especially with our insurance companies here and stakeholders who want to ensure that this is the best move forward for everyone in our community to provide this kind of safeguard for all the people of Guam who have a health insurance coverage of some type from a local company. So I appreciate it, and I look forward to the testimonies that are still to come. Thank you very much, Madam Speaker.
Ms. Mossy, Legislative Secretary Shelton. Next on the agenda, colleagues, and those are on Zoom, is Bill number 316-35 COR. Senator Therese Sherlai, I open the floor for you.
Oh, thank you very much, Madam Speaker. Thank you. So Bill 316 is an act to amend Section 1909A of Title I, Chapter 19, to amend 22203 of Title V, Chapter 22, Guam Code annotated, relative to increasing transparency and accountability by requiring earlier submission of financial statements and financial audits. The intent is to ensure that timely audits are made available to the public and to government officials so that we can make informed decisions regarding government finances and accountability. It would require that agency financial statements be submitted no later than 90 days from the October end of the fiscal year, September end of the fiscal year, in order to allow for completion of financial audits by March 31st. Currently, audits are for prior fiscal years are due on June 30th of each year. However, earlier completion of the annual audits will help to address deficits on a more timely basis. It will allow relevant or necessary adjustments to the current fiscal year budget while it's actively being discussed or while it's being prepared. And it will serve to better inform budget submission and deliberations for the subsequent fiscal years. As an example, our deliberations on the FY21 budget began in August. Of course, we tried to pass that by the end of August. The audit was released 2 days before the budget was passed, pretty much after our deliberations were almost done, even though it was due on June 30th. And so, we've explored, the reasons for that, but this is, again, we believe, consistent with what the OPA has said is their mission. And I'm so glad that the public auditor is here, so I'm looking forward to his testimony. But I'm quoting from the BBMR's report on the bill that says, their fiscal note says, according to OPA, a March 31 deadline is currently in place for all the existing financial audit contracts, with the exception of the government-wide audit. The OPA further stated this proposed legislation aligns with their strategic goal of delivering quality audit reports that are timely and impactful. And they said that there was no financial impact, does not impose additional mandates to the affected entities. It only seeks to amend the submission due dates for financial statements and audit. And so they categorize it as administrative in nature. So I'm going to end there because we have all the financial experts here. They don't need me to explain it to them, but I'd like to hear more from them. So again, thank you to Director Byrne and the public auditor, Benjamin Cruz, for being here today. And thank you, Madam Speaker. I think you're muted, Madam Speaker.
I apologize. Thank you, Senator Therese. With that being said, I'll go ahead and acknowledge the public auditor, Speaker Benjamin Cruz, Auditor Cruz, allow you to present your testimony. If you can unmute.
Okay. Actually, why don't I allow Ed to speak first, and I'll speak after him.
I'll go ahead and yield to that. Mr. Byrne, please.
Okay, thank you, Madam Speaker. Good afternoon, or perhaps now I'm looking outside. Good evening, Madam Speaker and Senators. My name is Edward Byrne, Director of Department Administration, and it is a privilege to offer my testimony on Bill 31635. Department of Administration is responsible for maintaining the financial records of the Government of Guam, and that includes the preparation and submission to the auditors for audit the basic financial statements of the government. This bill attempts to address this matter, but it carries certain defects which I will address later in this testimony. I am by profession an accountant. My qualifications are broad or abroad. I first qualified as a chartered accountant in Britain. When I moved to the United States, I qualified as a certified public accountant and a chartered global management accountant. My training was with Deloitte in London as an article clerk. My training included audits of companies large and not so large, covering many industries and services. Accounting practices have changed over the years in response to underlying conditions. In times of high inflation, we introduced current cost accounting, current purchasing power accounting, and the compromise was a hybrid of the two. Through the years, accounting standards have become more exacting. For example, the introduction of the pension plan liability under GASB 67, 68, and 73, and the OPEB liability under GASB 75. Due to be introduced for the current year, but postponed by 1 year due to COVID-19, is GASB 87, which essentially treats leases of assets which last for more than 1 year as an asset acquisition. This will have a major impact on the balance sheet of the government. These are some of the factors that make it difficult to complete these statements by March the 31st. And if I could just be very precise about the date that they're actually due, our bond covenants require us in normal circumstances to complete our financial statements by June 28th. And it was obviously this year with the special conditions, we had to seek some relief from that requirement. But we are actually much more timely than some of the other territories who struggled much more during this pandemic. I am certainly an advocate for timely financial reporting. It is good practice, and good decisions can only be taken with current information. This indicates that more frequent and more useful interim reporting should be considered. I would suggest to you that, mandated by law if the senators so choose, quarterly balance sheet and income and comparative statements to be submitted to the DOA, so the DOA can compile full financial statements for fiscally responsible decision, may be a better path for this intention. There are legal mandates for agency reporting, but these do not generally require balance sheets and are inconsistent in form, and they tend to vary from the agency or the department that is required to submit them. My suggested practice would follow the financial procedures of all entities, which are made up of independently managed units under common control with common reported objectives. It's similar to the model of a group of companies, all of which have subsidiaries which operate independently, but their financial reporting is standardized. Good intentions, however, usually come with a cost. I would be remiss if I did not remind senators that the DOA manpower budget was reduced in the fiscal 21 budget by over 400,000. There are two factors required to improve financial reporting. One, adequate and trained personnel who have the necessary accounting training to understand the impact of financial statements and the adjustments needed to make them a true and fair representation of the underlying financial situation. And two, up-to-date software, which is the tool that accountants use. Without adequate funding, we will have neither of these, and the process will fail. At its extreme, this bill can be viewed as an unfunded mandate. We will have made no progress. Please, please allow us to have the necessary tools. The wording of the bill gives some concern. Section 1909, the second sentence appears to redefine the form of the financial statements to be submitted as to not necessarily conform to generally accepted accounting principles in force in the United States. And these statements must incorporate the requirements of GASB principles and in operation. If they do not, they cannot usefully be incorporated into the audited basic financial statements. Section 22203 is amended to provide standards for the preparation of financial statements up to 90 days after the end of the preceding financial year. This changes the duty from a process which is intended to last for several accounting periods to an annual exercise, but does not include the self-accounting units, especially those which are part of the all-important general fund. There is room for more clarity, but I don't know that we get there by just establishing an arbitrary time period. And I should point out that several self-accounting units, for example, the Judiciary, Department of Education, and indeed the legislature, are in fact part of the general fund and are instrumental in determining whether the general fund reports a surplus or a deficit. The preamble to the bill asserts earlier completion of the annual audits will help us to address deficits on a more timely basis. Senators, the solution to deficits is to eliminate them, as we have frequently advised the legislature, so that we can discontinue reporting them. We are close to eliminating the deficit on the general fund and the governmental funds, and a balance sheet on which assets exceed liabilities, as they normally should do, provide a much better basis for budgeting and financial control than one which is upside down. Elimination is to be preferred over reporting of a deficit which impacts the judgment which the reviewers of the financial statement give to our financial performance. DOA is more than happy to work with OPA to improve financial reporting, and does so now in this pandemic climate, during which the volume of financial transactions, principally because of the federal funding that has been made available, has doubled, if not tripled. Senators, please grant both DOA and OPA the resources they need to accomplish this. Additionally, the basic financial statements, which comprise 216 pages in fiscal 2019, this financial report is actually not complete without the single audit report on federal programs and a management letter which addresses financial controls. All these individual components of the annual audit require time and resources. This should not be done by mandate, but by cooperation between many employees of all the line agencies, funds, and component units of the government of Guam. DOA will strive for continued improvement as it takes pride in the finished product, which is relied upon by federal agencies, rating agencies, bond investors, as well as the legislature. Faster reporting, though certainly desirable, professionally and for other reasons, as I indicated earlier, does not necessarily lead to greater transparency, but again, uses resources. Thank you, Senators, for inviting me to offer this testimony. I will be happy to respond to any questions.
Thank you, Mr. Byrne. Public Auditor, Speaker BJ Cruz, you're recognized.
Thank you very much, Madam Speaker. I purposely asked to speak after Ed because I wanted the senators to understand that I have a very good working relationship with Mr. Burns. He's one of my WhatsApp people. And whenever I need any information, I'm constantly WhatsApping him at all times of day and night. But to the good Senator Terlahi, who introduced the bill, Senator, I fully agree with the intent of this piece of legislation. And when I took this position, it was for the specific purpose of trying to move these things up. With Mr. Burns' assistance when I came on, and with the RFPs that we sent out after he took over DOA, we were able to get 18 of the 25 contracts issued new RFPs. And in the new RFPs for the external audits, we both agreed that in order to try to get to a March 31st deadline, we needed to have a February 28th deadline for the GovGuam departments and agencies. And so 18 contracts with the auditors currently have a provision in there that requires them to submit the draft of the audit by the end of January and the final by the end of February, so that we can get all the information to Mr. Byrne and the GovGuamite auditor to get a March deadline out. This just all finished last year as we were doing it, and it required having everybody to catch up. Mr. Byrne had a brilliant idea that maybe it should be that we should require that the government agencies make quarterly reports to DOA. I didn't realize that they weren't doing it. I didn't realize that they weren't closing their books at the end of every month. I mean, the departments. I didn't realize that they were not closing at the end of every quarter. I was shocked to find that they were closing in November, some in December. So this year, besides the provision in the contracts that required an early completion and issuance date, I required that all of the agencies submit to my office a Gantt chart schedule of what they plan on doing throughout the year. Admittedly, I sent out that notice and request in late August, after it looked like we weren't going to be able to get the last government agency out until August. And I was furious. And so when I sent that out, they were all the agencies have since submitted to me a Gantt chart, which showed everything that they're supposed to do. They were supposed to work with the external auditors and supposed to have milestones. And eventually, if hopefully not, it's not going to happen this year, unfortunately, but hopefully for next year, there will be quarterly closings, there will be half-year closings, there will be all these things that happen all the way along, so that when we close next year on September the 30th of 2021, that we will immediately be able to get everything out, get the 90 days and be able to meet your March deadline. But right now, the departments just aren't aren't doing that. They are complying with the Gantt chart, and all Gantt chart currently has is what they had to do between August and January to make sure that the audits came out in time. My next directive to the agencies will be to do a Gantt chart of the entire fiscal year, which shows when they're supposed to do the monthly closings, when they'll do the quarterly closings, when they'll do the half-year closing, so that the following year is going to be easier. It really is pulling teeth and almost like getting braces to try to straighten teeth like mine. It's very, very slow. And as Mr. Byrne mentioned, the one thing that the last 2 years has caused the biggest delay has been the OPEB report and the pension report. The OPEB is the other pension, post-employment benefits, and the pension is the retirement fund. And because those were new GASB rules, 2 years ago, it took a long time to get that done. And consequently, everybody, including a lot of the government agencies that were done, had to wait for the Milliman report to come out and for the KMS report to come out. So this year, working with Mr. Burns, I was able to get Milliman to understand that I'm not going to tolerate a late issuance of the pension report and the KMS report. And so 2 weeks ago, Ed sent to me a copy of the Milliman report, which I sent to the external auditors, because the external auditors have to share that with their departments, because the departments have to look at it and say, we don't agree with the way Milliman has stated the amount that our employees, what our obligation is. In fact, I know of one agency that when they had a chance to look at it, has already notified EY and the other external auditors. They don't agree with what Milliman is saying. So the department has to look at the Milliman report. Then the external auditors have to also send it up to their national offices, so that their actuaries in New York or wherever it is will go through all of the Milliman report and audit it, so it can be sent back down to be redone by Milliman, so that it can be re-reported out and included in everybody's audits. The same thing with the KMS. That requires retirement fund. All of the government agencies to submit how many employees they have, how many are retirees, and get that all to Ed. That has been delayed in the past, and sometimes that has caused a really late report. And so this year, with Ed's cooperation, he has submitted to me an early report right after the end of September. Who hasn't submitted their documents yet for the KMS report? I was immediately on it. I was texting, I was emailing all the department directors, hey, get this in, get this in, get this in. We finally got everything in last Friday. I'm hoping that the KMS report will then come out sometime next month. And when that goes up and down the EY and Deloitte, we'll be able to get it out to the agencies in January, and we can close the reports. Because in the past 2 years, I've had departments that have had their audits complete completely done, except for the OPEB and the pension, their pension liability. And when those first came out, let me tell you, they were hollering and screaming because some of them, it took them from they were in a surplus, but because of their pension liabilities, it took them immediately into a deficit. And they were like trying to explain how it was that it wasn't really true that they were in a deficit. It's a long range deficit because of the pension, and it's not, and there's the OPEB, and it's all kinds of things. And so there was a lot of teeth gnashing. But working together with DOA, hopefully we've got this under control, and we've got the Gantt chart, and I have scheduled entrance meeting with every single agency and reminding them that this year I'm not going to allow them to get to just float. I'm wanting to know where they're at. And when I got off a meeting today and found out that they had just closed last month, I was down the throat of the controller of that department saying, why did it take you so long to close?
Speaker BJ, did we lose you? Public auditor? Rudy, are we still on, Rudy, or did we lose? AV? Can you guys hear me?
Okay.
Okay.
Just go on.
We're going to go ahead and proceed, and I'll give him an opportunity to speak back. So at this time, I will go ahead and open it. Senator Therese, did you want to close, or let me see if we've got Speaker BJ back. Yes. Speaker BJ? Auditor? Auditor, can you hear me?
Yes.
Okay.
I just wanted to just understand. I have a good working relationship with Ed at the Department of Administration, and we're trying to straighten out the system. When we both took over, let me tell you, the teeth were more crooked than mine. And it's taking some really hard braces to try to get it straightened and have these people understand there's got to be monthly closings and quarterly closings. And it would, so we're working on it. And this year, I hope to be able to get it out by March. But it's going to be some teeth gnashing. And I have to second Ed's one point that he made. The legislature is really going to have to support the Department of Administration in getting personnel. I'm not going to ask for me. I'm just going to ask for DOA, because they need the accountants there to be able to run that department. When we issued the GovGuam-wide report in August, there was a management letter and a compliance report attached that had some pretty critical things to say about the government. And when I spoke to Adelup, I made them understand, read the compliance report and you'll see where the shortcomings are, and talk to Mr. Byrne. And they spoke to him about some of the things that are there. And to his credit, they've started an audit division or section. I know that personally because he hired away 2 of my auditors. This week is the last week of my 2 certified fraud investigators. Ed has taken them to his department, but he needs accountants to get the books straight. And he really does need an FMIS that's updated, that's into the 21st century. The AS400 was started, I think, before some of the senators were born. It's that old. And they need something that's 21st century if we want to get these things out in a timely fashion. That's something you're going to have to take up with Ed about how to be able to deal with that. But it's imperative, because we've got to come into the 21st century, because, as he put it, our financial audits are looked at by everybody. The rating firms, the bond agencies, are the buyers of the bonds, the bondholders. And if we can't get these things out in a timely fashion, or there's problems with it, that's going to affect everything. So that's my testimony.
Thank you, Speaker VJ, Public Auditor. At this time, Senator Therese, as the author of the legislation, I yield it to you for opening or comments, or would you like to close?
Oh, I'd like to ask some questions if possible. Yeah. And so first of all, thank you, Director Byrne. And of course, thank you, Public Auditor, former Speaker Cruz, for your testimony and for the progress that you've described today. So that's great news. Very much optimistic about that. And I have no questions about your capabilities to get that done. I love the idea of the quarterly statements as you described, and so I'm looking forward to that. I'm glad that you've implemented these things without any need for further mandate, and you seem to. So I guess if I could just clarify a couple of things. So, Mr. Byrne, you said that we wrote in the bill that we wanted the agencies to submit in such form and detail as the public auditor may require. And you suggested that that form might conflict with GASB. So I hear you, and but I would just like, to clarify, that's what you mean, right? You want it to be GASB consistent and not allow not this auditor, but perhaps an auditor in the future to depart from what you really are going to need in your contract.
Yes, Senator, if I may. I mean, the financial statements have to comply with generally accepted accounting principles. So there are kind of those basic principles, and then on top of that are these GASB rules. Yes, that's exactly.
I was thinking that since the auditor is the one who makes the contracts with the auditing companies, that they also are going to be in those contracts writing out the requirements. And so I just wanted the requirements to be consistent with whatever they agreed with these auditing companies. But so I'm hoping that that could be worked out. And then, but I hear you on the other one where I say financial statements, we want many more. That was too narrowing there when we have many other financial statements that we need to require. So I will amend that language. So Auditor Cruz, you had said at one point, I can't remember if that's at a public hearing or in the media or somewhere, but that if we could resurrect this bill, if we could amend it so that boards and commissions are prohibited from giving increments to directors and deputies if their agency fails to produce a timely and clean audit. I guess as a further chip for you to use to get them to get the information to you. Do you think that is still necessary?
Well, it would seem to me that the timely issuance of a financial audit and a good financial audit should be part of a performance evaluation for which a director, or an agency head gets a substantial increase. Unfortunately, there's really only four agencies, I think, GWA, GPA, GSWA, and PAG, and airport, 5 that are on their own. But they're the only ones that get performance audits and increases. Mr. Byrne can get a good one out, but his salary's not going up the same way the rest of them go up. It's just because they're out there and they can have an annual performance audit by statute. We've mandated it. And so it would just seem to me that it should be put in that one of the things that they should do is to have a good financial audit. I can't imagine someone getting a bad financial audit. It has happened, but that could be the time that they get an increase.
All right. It's the Gantt, is it GANT, the Gantt chart that you described?
GANNT.
NNT, okay. The Gantt chart sounds like a great idea. I don't know what that looks like, but I guess I'm wondering. I guess it's
what it does is that it
sets a
what
schedule.
It does list all the things that you need to do, and it has a date that has to be done. This has to be provided to us on this date. This has to be provided to us on this date, and it goes along the year, and you see the whole year or the time period all set out, and you can follow. You can look and say, this is November the 19th, and go down the thing and say, you can call the agency in and say, today's November the 19th. This should have been in, this should have been in, and this should have been in. If they don't say no, then you're not keeping to the Gantt chart.
All right.
So that's the way that I'm trying to straighten the teeth.
Yeah, I love it. I love it. I hope both of you are successful. The bill is intended to help all of us to the same goal. So I'm open for recommendations. I'm open if you think there's another tool besides mandating it in the law that would help you to urge these agencies along. And I know that, for example, if you're the auditor and you're the director, maybe we're going to get right on FY20. So I'm looking forward to that. But I think in the future, if there's anything that you think needs to be put into the law just to make it more standardized, to keep everyone who's, when we have a changeover, that they are, that, we don't go backwards, that we keep with that same rhythm or improve it, in fact. So, but I hear you about the resources. Oh, Mr. Byrne, one more question. I think it was the Director of Revenue and Taxation that said, that mentioned that I thought she said you were going out for an RFP for that at this point for software?
Yes, Senator, we are trying very, very hard to go out to complete all the requirements to go out for an RFP so that we can test the market and what software is out there that can help us to achieve what the public auditor was talking about.
All right, I appreciate that. Okay, Madam Speaker, thank you. Thank you again.
Senator Therese, Vice Chair, Senator Kelly, do you have any comments or questions? Vice Chair.
Not at this time, but I think it's been very productive dialogue. It's updated us. It's let us see the good efforts that everybody is making. And I really appreciate the author of the bill's openness to these sort of recommendations. And so I just appreciate being able to listen in and hear of the progress and the recommendations that are being made. So, Terima kasih.
Thank you very much, Vice Chair, Assistant Majority Leader. Do I have any questions from Minority Leader or Senator San Agustin? Any comments, Minority Leader or Senator Joe?
Well, the only comment I have, Madam Speaker, is for Mr. Byrne. I'm just very curious is that if there was a way we can find funding, and I'm thank you, Speaker BJ Cruz, for saying you're not going to ask for any more money next year. And we'll just concentrate on DOA, but I'm just concerned about Ed, on your side. My concern is that let's just hypothetically say we were able to find funds to provide you and assist you. What's the speed on getting people hired and getting the things done? Because, you know, as much as the OPA is going to say, we got to help you. In the past, in the last term, we gave additional funding and you weren't there and you walked in at the tail end of it. And then now you're there now for 2 years. I'm just concerned is that as we find ways to assist you so we can get the audits going and the statements going, because every one of my colleagues are going to need that information. There's no doubt. And getting that information is very important for us. But I'm just concerned is the speed in hiring, the speed in getting it all wrapped up. That's what I'm concerned about, Mr. Byrne. Okay.
Yes, thank you, Senator. And if I could address your comment, I'm concerned about it too. You know, I certainly want to get the best talent to work for the government of Guam, whether it's accounting as is needed for this particular task, but there are other tasks that need professionals and qualified people. And certainly as far as DOA is concerned, we've made strides too in processing people who want to work, you know, applications and HR procedures. We've made progress in that too, at getting people into the government. But as far as the public auditor made reference to the number of accountants in DOA, and as soon as I walked in, I saw that it was an issue in that I have fewer accountants than, for instance, and I don't blame them for wanting accountants, like UOG. I have actually fewer people with the title accountant than UOG has. And that's something we need to fix. I did open up a dialogue before we got into this pandemic. I did open up a dialogue with UOG that we were going to open up a program of a kind of sandwich course so that their accounting students would spend some time at DOA and learn the government accounting, because I mean they also have to learn business accounting, but they would learn government accounting by spending some time with us, and with the hope that we would be able to eventually employ them when they qualified or when they got their degree, or hopefully some of them go further and get a CPA qualification. It's certainly a long-term objective, but we're going to make it as quick as we can. So please send the money our way.
Well, you know, Ed, one of my main concern is, I brought this up even with DOE, is that we always have a shortage of teachers. Now you have a shortage of accountants. I'm just concerned that at like the University of Guam and probably GC, when they have the accounting schools, I'm just wondering what plan is there to recruit them. You know, you like you mentioned, do an internship with DOA,
yeah.
And then basically during the internship, they're offered the job. So at the end of their course, they're going to be picked up, and then that's where, you know, you got it's like what the military does. They on the junior year, they already offered a career in the military. It's done. They're guaranteed. And I'm just concerned is that because it's hard to recruit. I mean, you mentioned UG's got more accountants. So does DOE has more accountants than you guys, and so does probably revenue and tax. But I'm just concerned is that I just like to see you guys getting well and you know, on track. So because you're the one I'm going to turn to anyway, Ed, and you know that I reach out to you about as often as the OPA, but we'll be reaching out to you soon. Thank you, Madam Chair.
Thank you.
Madam
Thank you. I look forward. Thank you, Senator.
Thank you. Minority Leader, yes, please, you're recognized.
Thank you, Madam Chair. Thank you, Mr. Byrne and Speaker BJ. Good to see you as always, even though I'm kind of like only seeing half of your face on the screen. But there you go. Straighten up that back. No. You know, I really support this bill, and I know I was anticipating every excuse in the book, you know, from DOA, you know, that they can't do it, or, you know, whatever excuse that was given today. But, you know, they're valid excuses, you know, and I know you need the assistance, but I'm hoping that you think outside the box, understand the position that the legislature is in, especially coming up to this, you know, physical crisis that we're into. I mean, we need to go monthly, on a monthly basis, to start looking at revenues that are coming in, to adjust those, or to prepare the agencies what they may not get as far as allotments are concerned. But, you know, we've had issues too with certain directors not providing information in a timely manner. And I was wondering, maybe with Speaker BJ Cruz, former Speaker BJ Cruz, with the annual audit impacting fiscal decisions and including the availability and uses of excess revenue and the preparation of the budget in the fiscal year, what penalties, if any, can be enforced upon agencies' heads for late submission / failure to comply to OPA's requirements? Any suggestions? Are you on mute? Okay, there.
You know, you guys are going to have to figure out what's going to be able to go fly. See, because it's going to be a thing of, I may have said at one point in my passion said maybe it should be part of the performance audits, but then you guys are the ones that are up for re-elections more often, and it's whether or not you guys are willing to penalize them. Because if it doesn't, then, you know, I mean, there are some where the late Speaker Ben, he created the EFSC at education, and if one of the members don't show up, then their department has to pay $250 to the sports fund at DOE.
Thank you for that.
You know, but that they take it from the department, it's not out of their personal funds. What good is that, you know? Or are you going to hold them personally liable? I remember when there were times when I was there when I said no, money had to be returned, and then everybody felt bad for the people having to return money. Then pretty soon there was legislation for giving it. You guys have to figure out what it is. I mean, that's why I'm not there. I'm here now.
You know, considering you're the one that needs this information, and you talk about straightening teeth. Well, what about pulling teeth? You know, and getting these directors to provide the information you need in a timely manner, and that means, you know, what would you do? Because it is, you know, information that you need. But you're absolutely right. You know, sometimes it gets too political, and when we're trying to get something through. And feeling sorry when we implement a law or a penalty for someone, and then somebody's cousin comes up to us, you know, senator, and say, I'm sorry, you know, that's my cousin, don't do that. You know, it doesn't make any sense. And I think today's time, you know, a public auditor, I think, is more transparent now with, you know, Facebook and media and social media that's going on. People are finding out sooner than later and of what's going on. So I appreciate that answer, and I, miss you being on the bench here at the legislature because you provided great insight. And but I appreciate all the work that you're doing and holding these people accountable on your end. So thank you, Madam Speaker, for the opportunity. Thank you.
Thank you, Minority Leader. With that being said, if there's no one else wanting to testify, Senator Terlahi, I'll give you the opportunity to close.
Thank you again to Director Byrne, to Public Auditor BJ Cruz for your testimony and your assistance. So, we all have the same goal. I think the legislature is very interested in this information. I'm glad that you're demanding it more regularly. Excellent suggestion. I agree. So, of course, we just want to contribute to good governance, transparency, and for us, our good decision making, and not for us to be operating in the dark. I feel very uncomfortable doing that, and so we also want to avoid deficit spending. So the more timely the information we can get, the better. And but thank you all for your work in this regard.
Thank you, Senator Therese. Last bill, last but not the least, I apologize, Senator San Agustin. I really tried. Bill number 418-35. Senator Joe San Agustin, you are recognized.
And thank you, Madam Speaker, for the opportunity to speak on Bill 418-35 COR. Madam Chair, Bill 418 COR is introduced by myself. Is an act to amend Section 8104P of Article 1, Chapter 8, Title 4, Guam Code annotated, relative to including Department of Correction parole officers as uniformed personnel for retirement purposes. This legislation will include hardworking and dedicated men and women who work at the Department of Correction as parole officers, and is in line with ensuring that their status as law enforcement is not watered down or less important than that of others who serve as uniformed personnel. The bill will affect the dozen personnel who serve the people in ensuring parolees are held accountable for their parole conditions, but their work extends beyond parolee monitoring. They're also social workers and counselors, helping parolees to prevent recidivism, helping to keep parolees in line with the programs that they need to reintegrate with their families and the community. I want to thank you for hearing this bill. I look forward to any testimony that we might receive. And I ask my colleagues to support this measure as we work towards ensuring parity for all our law enforcement officers. Thank you, Madam Speaker.
Thank you. Thank you, Senator San Agustin. I do know that we have the Director of DOA that's still here. Thank you very much. And Mr. Kanata from Department of Corrections. But I will note for the record on this bill that we did take the time to invite Paula Bloss, the Director of Guam, Government of Guam Retirement Fund. And we did send an extra message out tonight. And we'll try our very best to get testimony from her also. At this time, I'll go ahead and open it up to Mr. Ed Byrne, Director.
Thank you, Speaker. You've just been speaking about the retirement fund, and it is the retirement fund that has to advise the effect, particularly on cost of this change that the bill would affect. It isn't. There might be an actuarial cost that needs to be included when it comes to putting these numbers into the government financial statements, but that has to be determined by the retirement fund. And I look forward, as you do, to getting that information from them in due course.
Thank you very much, Mr. Byrne. Mr. Kanata.
Good evening, Madam Speaker. Thank you for the opportunity. Matter of brevity. On behalf of the Director of Correction, Cabralido, Deputy Director Camacho, myself and my parole staff, we do encourage or solicit your support for passing this bill. Since the 36 years I've worked here, that probably doesn't affect me, but it's always at the tail end that we have to request that we be included. We're always omitted from a lot of these law enforcement bills that would affect us, from the hazardous pay and now to the retirement. So again, matter of brevity, I request that the senator support this bill. Jesus Masi. Any questions?
Thank you. Thank you, Mr. Mike. I'm going to go ahead and yield to Senator Sonagasti. I apologize. Let me go ahead and ask my Vice Chair if she'd like to comment at this time.
No, it's a pretty straightforward bill, and I appreciate being able to be here and listen to the testimony. So yeah, I'm just here to listen at this point and see if anything stands out one way or the other, but I appreciate being called upon.
Thank you. Thank you very much. Senator Sonagasti, any comments or questions?
Well, Madam Speaker, we are reaching out to the retirement fund to find out what is the impact going to be, and then be able to brief the individuals that will be affected, so they understand that. And like Mr. Byrne brought up, if there's any cost, then they all have to understand that because they were never part of it, which they should have been in the beginning. And like Mike brought up, is that these are the folks that should have been addressed. When we talk uniform officers, it should have captured everyone. But these are the groups that just got missed. And all I'm trying to do is to bring some parity. I want to make sure that everybody that needs to be addressed, be addressed. And once we bring parity and then we brief, I'll get a hold of Mike and the director, and we'll find out from a retirement fund, what do we need to, what are the impacts? And I think once we speak to them and they understand what's going on, then they'll have an understanding on how they can be included as we move forward. All right. Thank you, Madam Speaker.
Thank you very much. Maybe I'll ask these questions from DOA. I just want to make sure. Mr. Ed Byrne, is it existing right now? Uniform personnel can be expected to retire 5 years earlier than other government employees? Is that in? Just wanting to make sure. I wanted to make sure it wasn't an oversight on my part.
No, no, that's correct. That's correct, Madam Speaker. Yeah. Thank
you. Thank you. As that is being said, based on the context of this, right? Because their uniformed personnel is afforded that opportunity. That only recognize as the correction officers from DOC as the uniformed personnel, and the oversight for me personally on the parole officers. They were ineligible for this, and I think it's only fair that we correct this oversight, as the good author has stated, and I'm hoping that he could make me a part of this co-sponsorship with him, because as in the efforts that we did work with the Department of Youth Affairs and all that, it was to correct those truly law enforcement personnel that are uniform or work in the law enforcement entities, that these guys be included. So I want to say thank you for that. And Mr. Kanata, Ramon Mike, I'll disclose for the record that I know this effort has been long talked about for many, many years, and we're finally giving it up to the forefront. I will ask retirement, as the oversight chair of retirement, I will ask them, and hopefully work closely with the author to have at least retirement give their perspective on this, what the fiscal impact is. We did request for a fiscal impact as required. We did not get anything yet. But Mr. Byrne, I just want to say thank you for being here on this issue. So I support the efforts. I support the intent, and I think that if we can allow those, and this is expected for uniformed personnel already, then we should already include them. So thank you very much for being here, and thank you, Senator San Augustine, for literally taking this to the forefront. If there's no other comments from you, Senator San Augustine, I will go ahead and do the closing. Vice Chair, do you have any last comments? Vice Chair?
No, but thank you for asking.
You're very welcome, Vice Chair. So I'll go ahead and work on the closing. If first, and say thank you to all those who appeared. I know there were some that had to log off, but if there's no one else left to testify tonight, public hearing on bills number 302-35 COR as introduced by Senator Luis B. Muña, bill number 304-35 COR as introduced by Senator Luis Muña, bill number 325-35 COR as introduced by Senator Amanda L. Shelton, Vice Speaker Selena Cruz Nelson, and myself, Speaker Tina Rose Muña Barnes. Bill number 316-35 COR as introduced by Senator Therese M. Terlaye. And last but not the least, bill number 418-35 COR. All these bills have been duly heard. And before I do the final adjournment, I'm just going to say individuals who wish to submit testimony will have can do so by emailing it to speaker@guamlegislature.org, or they may hand deliver it to our office here at the Guam Congress Building at 163 Chalan Santo Papa, Hagåtña, Guam 96910. And it is now 7:08 p.m. Thank you, everybody, for joining us. Si Diyos ang binidisi, hamdun todos. Thank you. God bless.